Why use genomics? Because, it's a hot topic. It has been a hot topic for several years now. Your patients are going to ask about it. They're hearing about 23andMe's on TV. They're hearing from, buzzwords, or they're seeing in even like a Goop article maybe, or a Mind Body Green article that MTHFR, and they need to know about MTHFR. So you guys need to know what that means and how to use it in your practice most successfully. Changes in alleles or base pairs create a variant and change the expression and the function of the genotype, right? And there are 10 million SNPs in the human genome. Only a percentage of these SNPs have been found to be relevant, which I want to underline and underscore that point, that there's a lot of SNPs that you get on a Prometheus lab. I don't know if you've ever run any of those, that we just don't know enough about. So we can't make assumptions until the research supports it. Therefore, only the studied genes should be looked at for health purposes. Okay, so what is methylation? Like at the very basis, what is methylation? Methylation is the addition of a methyl group, which is a carbon and 3 hydrogens into another molecule. And the body's main methyl donor is SAMe. Okay, and SAMe activates other enzymes by donating its methyl group. And this either turns on or off some kind of process, okay? And it happens in all cells of the body. All right, every cell methylates, but we specifically think about it a lot in the liver and phase 2 of liver detoxification. So what are signs that your patient needs some support? Well, mood fluctuations and irritability, depression, anxiety, those conditions that we're going to cover today, bipolar, pregnancy has an incredible demand for methylation. If you get really red-faced after exercising, that's a sign of histamine, and it's just a sign that something in methylation is not going well. Maybe you don't have enough SAMe. Intolerance to alcohol, low energy and toxic feeling. Just so you know, nitrous oxide makes them feel awful. That's at the dentist when they get dental work. People with MTHFR, specifically that gene mutation, we know they do not tolerate nitrous oxide at all, as well as other medications. Let's talk about pregnancy for a minute here. So the ability to make and generate as much tissue as well as for the mother as well as the baby takes in a tremendous amount of choline, a lot of choline. And choline is a major nutrient that you need in order to methylate correctly. The need for phosphatidylcholine is exceptionally high in pregnancy or somebody wanting to get pregnant. So phosphatidylcholine is, I think, deficient in 90% of women that are trying to get pregnant or have gotten pregnant. So you want to make sure that you're giving them some sort of choline. So again, take your detailed history, know what the symptoms that they're struggling with so you have an idea of what you're trying to treat, because a lot of times people go down rabbit holes and they miss their patient, right? And I don't want you to do that. In functional medicine, it can be a big problem that you run all these labs and you forget what they came in for. So try not to chase after all the other things and relate back to why they came in. What are they wanting help with? And it may be that you have to go several feet deep within all of this, but we should always remain in the scope of why did they come in? What are they trying to what are they looking for solutions for?